Thanks for sharing that point. I think you bring up several good points. One, the digital divide. What are we doing for those that aren't connected virtually? And we see that, and even Dr. Randolph, during this pandemic, numbers seem to be higher amongst mental health issues than deaths of the COVID virus, but still those are two very prominent. And Dr. Robertson, you mentioned that too, in terms of the mental health component that many people wrestle with. And so as even we go forward, how do we really help churches? You mentioned one thing, Dr. Keith Norman, about not, staying virtual, not opening the doors. But I think even with the best, some people are going to open those doors. And should they be concerned if something breaks out, even with the best of practices, go in this door, use hand sanitizer, stay apart, do all this? Do they need to have a way of assisting with contact tracing if something were to happen and people all went to church that Sunday? Could you address that, Dr. Randolph?
Well, yes, I think a couple things I want to sort of highlight. I think it's going to be very important that the church get across to its members the exercise of preventive measures and safety measures is not a reflection of a lack of faith, but more so a responsibility to not harm others, or to do unto others as you would have them do unto you. And so I think, first of all, that people need to understand that, if you're sick and you stay home, that doesn't mean that you have less faith. God can deliver you and heal you in your home as well as if you were there in the sanctuary. And I think we have to really reemphasize that. Right. But yeah, the churches need to sort to make sure that they have a list of their congregate, of their members, have some indication of who may have been present. Currently, in terms of the health department, we have in place a COVID investigation team. And we're actually in the process of bringing on 141 employees who will be directed and dedicated to doing nothing but the COVID-19 response. So if someone were to be found to be positive, we receive notification of that, the health department would have investigators that would contact that person, interview that person, find out who all that they have been exposed to, whether it was at work, in the home, or at church. Now, the thing is that at church, they may not know who all was at church with them, or the names of the people who were at church. That's where the pastor, leadership of the church will will have to play a very important role, because our investigation team may contact the pastor and said, a member who attended your church last Sunday found to be positive. We need to have some idea of who all was present at church on that day.
Yeah, this has happened already in several churches, by the way.
Right, exactly. And so the pastor will need to be able to send out at least letters to all the members saying, without naming anyone, that there's a possibility that on the first Sunday, you may have been exposed to the COVID-19 virus because one of our members was found to be positive. And therefore, we're asking that you, notify the health department, public health officials. And we will subsequently advise them in terms of whether they need to be quarantined or not, and based on the degree of exposure that occurred.